Hi everyone, and welcome to the Academy of Online Radiology Education blog. My name is Aaminah Kobeisy, a postdoctoral research fellow at Massachusetts General Hospital. The title of this presentation is The Role of AI in Pulmonary Embolism Detection. We will be going over two studies that assess the accuracy of AI algorithms in detecting PE. The first study is titled Accuracy of a Deep Neural Network for Automated Pulmonary Embolism Detection on Dedicated CT Pulmonary Angiograms, and was published in the European Journal of Radiology. This study aimed to assess the performance of a deep neural network-based algorithm for automated PE detection on CT pulmonary angiogram scans. This was a retrospective study that included 903 patients from a single center who had CTPA scans due to suspicion of PE between September 2022 to January 2023. After implementation of the AI algorithm on CTPAs, subgroup analyses were conducted to assess the algorithm's performance, taking into consideration body mass index and PE location. BMI-based analysis was performed in obese and non-obese patients by dividing patients into two subgroups, those with a BMI less than 30 and those with a BMI greater than 30. PE location-based analysis was done by dividing the pulmonary artery system into three levels: central arteries, which included the main pulmonary artery and right and left pulmonary arteries; lobar branches, which included the right upper lobe, right middle lobe, right lower lobe, left upper lobe, lingula, and left lower lobe branches; and lastly, peripheral regions, which included segmental and subsegmental branches. In cases with multiple emboli, the location of the most proximal PE was considered. Results showed the prevalence of PE was 12.2%. The model achieved a sensitivity of 84.6%, specificity of 95.1%, positive predictive value of 70.5%, and negative predictive value of 97.8%, and had an overall accuracy of 93.8%. Among the false positive cases, common sources of error included lung masses, pneumonia, and contrast flow artifacts. Among the false negative cases, causes included chronic and subsegmental PEs. The prevalence of PE was similar in obese, 12.2%, and non-obese patients, 11.9%, and the algorithm's accuracy for detecting PE was 92.5% and 94.6% respectively. Key findings from this study included: this AI algorithm could detect all central PEs, most lobar PEs, and fewer peripheral PEs. This points to excellent diagnostic accuracy of central PEs, but further improvement is still required for lobar and peripheral PE detection. No significant difference was found between BMI subgroups, and algorithms such as this one could potentially aid radiologists in exam prioritization and rapid diagnosis of PE. The second study we will look at is titled Implementation of an AI Algorithm in Clinical Practice to Reduce Missed Incidental Pulmonary Embolisms on Chest CT and its Impact on Short-Term Survival. This study was published in Investigative Radiology, and it aimed to assess the effect of an AI algorithm on the detection of incidental PEs and analyze its effects on patient outcomes. This was an observational single-center study that included 5,298 chest CT scans performed for indications other than suspected PE. There were two cohorts in this study. Cohort 1 consisted of 1,964 patients whose radiology reports were produced before the application of the FDA-approved AI algorithm for incidental PE detection called ACORE Medical, and Cohort 2 consisted of 3,334 patients whose CT scans were assessed after the implementation of the AI algorithm ACORE Medical. For comparison, Cohort 1 was reviewed retrospectively by the AI algorithm. In both cohorts, any differences between the original radiology reports and the AI output were reviewed by two cardiothoracic radiologists. Results showed in Cohort 1, the prevalence of confirmed incidental PE was 2.2%, or 42 cases, and the AI detected 61 suspicious incidental PEs, resulting in a sensitivity of 95%, a specificity of 99%, a positive predictive value of 69%, and a negative predictive value of 99%. In Cohort 1, radiologists overlooked 50% of incidental PE cases. In Cohort 2, the prevalence of confirmed incidental PEs was 1.7%, or 56 cases, and the AI detected 59 suspicious cases with a sensitivity of 90%, a specificity of 99%, a positive predictive value of 95%, and a negative predictive value of 99%. The rate of incidental PEs missed by radiologists dropped to 7.1% after AI implementation, showing substantial improvement. Key findings of this study included the implementation of this AI algorithm significantly reduced the rate of missed incidental PEs from 50 to 7.1%, thereby enhancing diagnostic accuracy. Despite this improvement, the 90-day mortality rate remained unchanged, possibly due to the fact that most patients in this cohort that had incidental PEs were on anticoagulant therapy. These findings highlight AI's potential to assist radiologists in accurately identifying incidental PEs. In conclusion, AI implementation has the potential to improve diagnostic accuracy and speed in PE detection, which can help in prioritizing critically ill patients. However, further improvement is still required, and larger multi-center studies need to assess the generalizability of algorithm performance. Thank you for watching. For more updates on the latest research in radiology, be sure to follow the Academy of Online Radiology Education blog series. See you next time.